This is Hailey Dean with Diagnostic Medical Sonography 4410 Vascular Imaging. I chose tortuous vessels of the subclavian artery. My case study was of a 34-year-old male patient, no medical history to report, no hypertension, diabetes, cardiac disease. Presenting symptoms were headache, visual disturbance, and a left-sided numbness. Lab values were normal vital signs. They performed a chest x-ray and neurologic exam. Everything was normal, as well as an echocardiogram and hypercoagulation tests were all negative. MRI revealed an acute infarction in the right lateral thalamus, and CT revealed a severe tortuosity with elongation at the right subclavian artery and stenosis at the posterior cerebral artery. Pathology, the formation and development of tortuous vessels is still poorly understood. They're categorized by shape, basically. Tortuous being S or C shaped, kinking with an acute angulation ranging from mild to severe, looping defined as an exaggerated S shape, and coiling as a circular shape. Incidence, it's more prevalent in our older community, in the female sex and among those with high blood pressure. There's a lot of etiology associated with tortuous vessels, all kind of similarly related: aging, diabetes, obesity. The physiology, tortuosity can affect any range of vessels, from smallest like capillaries to largest, including the aorta. It can be localized to a single vessel or spread throughout the body, and often an indicator of other underlying issues like atherosclerosis, and often an incidental finding. And it's also something that can progress over time. It also decreases wall thickness and diameter. It can, the course of disease, it can be localized or spread throughout the body. Treatment procedures include, for mild, can go untreated. Severe with symptoms can be treated with reconstructive surgery, including a surgical shortening or a surgical stripping. The prognosis is good for symptomatic patients. It's been found to lower the risk of stroke. Based off my reading in the textbook and looking for sonography images for this case study, I wanted to note that as a sonographer, the challenge we face with tortuous vessels is that their twisting and turning makes them difficult to interrogate throughout their length with our ultrasound and Doppler equipment. As far as discussion goes, tortuosity increases the resistance to blood flow and can decrease or even occlude blood flow, and findings suggest that infarction of other organs may be an outcome. Studies have also suggested the strong association between tortuosity and mechanical characteristics of the vessel, like blood pressure and blood flow. Tortuosity has also been suggested as a risk of stroke. Surgically treated tortuous arteries have been found to lower the risk of stroke. Clinical pathway, the differential diagnosis can sometimes be tricky. It can be stenosis, stroke, or neuropathy related to the pain or numbness that symptomatic patients feel. And for this particular one, a subclavian steal, because it involved the subclavian artery. This patient underwent surgery through a supraclavicular approach. The proximal right subclavian artery was anastomosed and directly at the right common carotid. Luckily for this patient, both carotid vessels were normal, but angiography demonstrated that severe tortuosity and elongation at the right subclavian. And the reason this young patient underwent surgery was to hopefully prevent stroke and keep any reoccurrent stroke from happening because of the association between tortuous vessels and ischemic stroke. Here are my references. I just wanted to show some normal anatomy so I could point out where this patient's tortuous vessels were. So his was at a tortuosity and elongation at the right subclavian artery. And then he had a stenosis at the right posterior cerebral artery, and then an infarction in the right lateral thalamus. These are his MRI images, and you can see the acute infarction on the right lateral thalamus. And then his CT, the angio, and you can see that crazy tortuosity of the subclavian artery. And then this is the MRA of his neck, and you can see how that subclavian artery was straightened out after the anastomosis. And then this was histopathology of the subclavian artery, and you can see the kind of irregularity and the degeneration of the wall using the stain. And this was an ultrasound Doppler image that I did find. It wasn't of the subclavian artery, but it was of the common carotid. But I just wanted to show some ultrasound and explain how the tortuosity can increase velocity and how it looks with color display. And at the end here, these are some examples of the different types of tortuous vessels. Thank you very much.